Hello, my name is Carl Wierks. I'm a board-certified, fellowship-trained orthopedic surgeon practicing at West Michigan Orthopedics in Grand Rapids, Michigan. This is a brief video discussing recovery after hip arthroscopy. Hip arthroscopy is a minimally invasive surgical procedure often used to treat injuries in the hip joint, such as labral tears and impingement. Less commonly though, hip arthroscopy is the chosen method to treat tendon issues around the hip, such as snapping hip, gluteus medius, or proximal hamstring tears. Those recoveries differ significantly from the more common labral repair and impingement correction that I'll be focusing on in this video. Further, I will describe my personal recommendations for recovery after routine hip arthroscopy procedures. So specific restrictions or recommendations may be different under the care of a different provider or if there are unique considerations on an individual basis. Hip arthroscopy is a minimally invasive surgery that typically requires 2 or 3 nick incisions around the hip. One portal is for the camera itself, and the other portal or 2 portals are for the surgical instruments to access the joint. After the surgical repair, patients are expected to be observed in the recovery area for 2 to 3 hours before feeling ready to be discharged. During this time, they are observed by the nursing staff to monitor safe recovery from anesthesia as well as for pain control. Pain control is a natural concern for patients going into a surgery. Our team uses a multimodal approach to perioperative pain. This includes oral pain medications that are taken in the preoperative area just prior to surgery, a local injection of 3 to 4 different pain medications around the hip at the end of the procedure, and then IV medication in the recovery room. Oral painkillers are prescribed for home use, including a mid-level narcotic combined with Tylenol. Typically, patients are able to wean off the narcotic after a few days and transition to non-narcotic medication, such as Tylenol. Using this multimodal approach, pain control is rarely an issue. The only formal restriction that I prescribe after routine hip arthroscopy is 50% weight bearing on the surgical side for 3 weeks. This means that it is okay to partially load the surgical side using crutches, but only putting up to about half of the normal weight on it. Range of motion of the joint is encouraged. This means that patients may sit normally and sleep normally. In fact, resuming physical therapy the first day after surgery is recommended to initiate passive range of motion and muscle activation. Initially, physical therapy frequency is 3 times per week if possible, complemented by home exercise program twice a day. Patients are able to shower and resume normal self-care, but are restricted from lifting and carrying anything heavy. The first post-op visit is at 3 weeks, x-rays are taken, and the incisions are checked. Patients are then allowed to wean off of the crutches over the next few days by incrementally putting more and more weight on the surgical leg until they feel like they can comfortably walk unassisted. The physical therapy also then transitions to more of an emphasis on strengthening. Patients start returning to the more normal or out of the house, low impact activities such as office work or school. Driving is allowed for the right hips once crutch use has ceased. Physical therapy continues twice a week, and the home exercise program is held twice a day. Low impact exercise out of the prescribed physical therapy is limited to a stationary bike with low resistance. The second post-op visit is at 8 weeks. This is a clinical exam to evaluate overall recovery progress and strength gains. A more detailed discussion about the timeline of return to long-term activity goals such as exercise or sports is had at this visit. Physical therapy is continued weekly for another 4 weeks, again complemented by home exercise program. Normal daily activity and a return to non-physically demanding work are expected by this time. Low impact exercise is progressed as well, starting with a stationary bike with moderate resistance or swimming. An elliptical can be used at 10 weeks post-op, but I do not recommend any running until 3 months post-op. At 4 months post-op, more dynamic or sport-specific activities such as jumping, cutting, and acceleration can be initiated. Return to contact sport is not expected before 6 months post-op, depending on the individual and treatment, up to 9 or even 12 months. Overall, we see the bulk of the clinical improvement after this surgery in the first 4 months, but resolution of lingering symptoms can occur up to a year or even 2 years. Return to pre-injury level of sports varies, but is generally high, ranging from 85 to 90% in most cases by about 9 months post-op. In summary, hip arthroscopy is an outpatient procedure with initial partial weight bearing allowed for the first 3 weeks, closely supervised physical therapy and home exercise program, and a relatively high rate of return to pre-injury activities over several months. I hope you found this video helpful.